All right, welcome to the deep dive. Today we're taking a deep dive into canine parvovirus type 2, or CPV2 as it's more commonly known. And wow, you've provided some seriously heavy-duty scientific articles on this topic. I mean, this is going to be a real journey into the heart of a virus that, let's face it, strikes fear into the heart of every dog owner. So what we're aiming to do is distill all of this complex information, all of this research, into a clear picture of this pathogen. Think of it as a roadmap, really, to understanding a disease that poses a significant threat to our canine companions.
Absolutely. Roadmap is a great analogy. We're going to trace the origins of CPV2, where it came from, how it spreads with such ruthless efficiency, and what it actually does to a dog's system. And of course, we can't overlook the strategies we have at our disposal for diagnosis, treatment, and crucially, prevention.
Now, one thing that really jumps out from the material you've shared is the genetic variation of this virus. It seems like it's a master of evolution, constantly changing, and that raises some important questions about the long-term effectiveness of our current vaccines. That's definitely something we need to unpack for our listeners.
Right, because for anyone listening, anyone who's ever loved a dog or worked with dogs, understanding CPV2 is empowering. It allows you to recognize the risks, understand the importance of vaccination. We can't stress that enough, and maybe spot those early warning signs that something might be wrong. And that knowledge lets you make informed decisions about your dog's health. And that's what we're here for, to cut through the scientific jargon and bring you the most relevant and maybe even some surprising insights about this disease. Definitely. I think there are going to be some real eye-openers for our listeners today.
So let's get right into it. Now, one thing that struck me when I was reading through all these articles was how suddenly this virus appeared on the scene. It's like it came out of nowhere.
Well, that's what's fascinating and maybe a little bit scary about CPV2. It was completely unknown until the summer of 1978, and this is in the United States. And then, boom, it just exploded across the globe. It became what we call enzootic in many regions, including Brazil. And the initial impact was just devastating. Severe intestinal issues, enteritis, and even inflammation of the heart muscle, which is myocarditis. And this was in dogs of all ages. So, it really emphasizes how significant this disease became almost overnight. It's pretty remarkable when you think about it.
Yeah, it's incredible, isn't it, that something this serious could just appear so suddenly. And from what I gathered, it seems like younger dogs were hit particularly hard by this new threat.
Oh, absolutely. CPV2 very quickly became a leading cause of illness and death in puppies, especially young puppies. And the first cases reported in Brazil, those were around 1980, and it sort of mirrored what happened in the U.S. It affected all ages initially, but then it really took hold as an endemic disease, primarily in younger animals.
Yeah.
And this rapid spread across the globe, it really speaks to how contagious and adaptable this virus is.
Yeah, it really highlights the urgency of understanding this virus, doesn't it? So we've talked about when it arrived and the damage it caused, but what exactly is CPV2? What makes this tiny little entity so incredibly destructive?
So the culprit here is Canine Parvovirus type 2, which is a member of the Parvoviridae family. And these are incredibly small viruses, like unbelievably tiny. We're talking 18 to 26 nanometers in diameter. It's hard to even grasp how small that is. And they're spherical in shape with a tough outer shell called an icosahedral capsid, which basically means it has 20 faces. And this capsid, it's incredibly resilient, and that's one of the reasons why this virus can survive outside of a host for so long. It makes environmental control a real challenge.
Right, so it's built to last, which is not good news for us. What about its genetic material?
So the genetic material of CPV2 is a single strand of linear DNA. And that DNA, that's the blueprint for making more viruses, essentially.
Okay, so we've got this tiny but tough virus with its little packet of DNA, but how does it actually wreak havoc at a cellular level?
Yeah.
How does it work its way into a dog system and cause so much damage?
Parvoviruses, they're really clever. They need actively dividing host cells to replicate, to make more of themselves. And that means they target tissues where cell division is happening rapidly, like the lining of the intestines, the bone marrow, where all the blood cells are made, and even the heart muscle cells. Now, the S phase of the cell cycle, that's where DNA replication happens. It's like construction time for the cell. And the virus, it basically hijacks this process. It uses the cell's own machinery to make copies of its own DNA. And in the process, it ends up killing the cell. It's pretty insidious, really.
It really is. It's like a hostile takeover at the cellular level. And I remember from the articles you sent, this virus is not only tough inside the body, but it's also incredibly resilient in the environment.
Yeah, you're absolutely right. CPV2, it's got incredible environmental stability. It can survive for months, even years at room temperature. And what's even more concerning is that most common disinfectants, the stuff you use around the house, they don't really touch it. The only thing that's reliably effective is sodium hypochlorite, good old bleach.
Wow, so bleach it is. That's a key takeaway for anyone dealing with a potential parvo outbreak. So let's talk about transmission. How does this incredibly hardy virus actually spread between dogs, and who are the most vulnerable?
Well, it's highly contagious, and it primarily spreads through the fecal-oral route. So, an infected dog sheds the virus in their feces, and then another dog comes along and sniffs that area, or even licks it.
Mm.
Puppies especially, they explore the world with their mouths, so they're at high risk.
Makes sense. So a puppy sniffing around an area where an infected dog has been could pick it up.
Exactly. And it's not just direct contact with feces that's a concern. It can also spread through what we call fomites, which are basically inanimate objects that can carry the virus. Things like food bowls, toys, even leashes. And then there are mechanical vectors like people's shoes or clothing, even insects or rodents. They can potentially spread the virus from one place to another.
So it sounds like it's a constant battle to keep this virus contained. Are all dogs equally susceptible, or are there certain groups that are at higher risk of getting seriously ill?
While puppies under 6 months of age, they're definitely the most vulnerable. And there's this critical period between weaning, which is usually around 12 weeks, and when they've completed their full vaccination series. We call this the window of susceptibility. During this time, the maternal antibodies that they got from their mom, those are waning, but their own active immunity from the vaccines, that's not fully developed yet. So they're in this sort of immune limbo, and that makes them highly susceptible.
So they've lost their mom's protection, but they haven't built up their own defenses yet. Makes sense. What about different breeds? Are some breeds more prone to severe illness than others?
Yes, actually. The research suggests that certain breeds, like Doberman Pinschers, Rottweilers, Labrador Retrievers, German Shepherds, American Pit Bull Terriers, and English Springer Spaniels,
Yeah.
they seem to be more predisposed to developing really severe disease if they get infected. And on the other hand, mixed breed dogs are sometimes considered to be a little less susceptible.
That's interesting. The breed-specific susceptibility, it's not something you hear about very often. What about dogs that appear healthy? They're not showing any signs of illness, but could they still be carrying and shedding the virus?
That's a great question. And the answer is yes. Subclinical infections, they can definitely occur, especially in puppies that still have some of those maternal antibodies hanging around, or maybe they haven't completed their full vaccination series. There have even been cases where perfectly healthy dogs have tested positive for CPV2 in their feces. So they're shedding the virus without showing any symptoms, which is a bit scary when you think about it. And that's one of the reasons why this virus is so good at spreading.
It's like a silent spreader.
Hmm.
So you might have a dog that seems perfectly fine, but it's actually shedding virus and potentially infecting other dogs. And I think you mentioned earlier that co-infections, where a dog has parvovirus along with another pathogen, are fairly common.
Oh, yeah, absolutely. Co-infections with things like canine coronavirus or E. coli, those are pretty common. And they can make the parvo infection much worse, much more severe.
So it's like a double whammy, really.
Okay, so let's say a dog does contract parvovirus despite our best efforts. What happens inside their body? What are the mechanisms of this disease that we need to understand?
So once the virus enters the body, usually through the mouth or nose, it starts replicating in the tonsils. And from there, it spreads rapidly. It gets into the lymphatic system, the bloodstream, and it travels to all sorts of organs: the spleen, the thymus, the liver, the bone marrow, and of course the intestines, especially those intestinal crypts, which are like the little factories that regenerate the lining of the gut.
So it's a full-body invasion, basically.
Exactly. And viremia, which is when the virus is actually present in the bloodstream, that usually happens within 3 to 5 days after infection. And one of the tricky things about parvo is that dogs can start shedding the virus in their feces even before they show any symptoms. So they're contagious before they look sick. That's really challenging, isn't it? Because you might not even know your dog is infected until it's already spreading the virus. You mentioned the virus has a thing for rapidly dividing cells and something about canine transferrin receptors, TFR. Can you explain why that's important?
So canine transferrin receptors, or TFR, they're like little doorways on the surface of cells, and they're especially abundant on rapidly dividing cells.
Mm.
And the parvovirus, it uses these TFR to get inside the cells. It's like a lock and key mechanism. And once it's inside, it hijacks the cell's machinery during the S phase, which is when the cell is busy making new DNA. It's incredibly efficient at using the cell's resources to make copies of itself. And eventually the cell just dies. It can't keep up with the virus's demands. And this process, this destruction of cells, especially in the intestines and the bone marrow, that's what leads to all the horrible symptoms we see with parvo.
So it's not just damaging the cells directly, it's also crippling the body's ability to repair and regenerate. And I know the classic sign of parvo, the one everyone dreads, is that severe bloody diarrhea, what's called acute hemorrhagic enteritis.
Yeah, that's right. And the severity can vary, depending on the dog's immune system and other factors. But that bloody diarrhea, it's a really bad sign. Now, the initial symptoms, those can be pretty nonspecific. Things like loss of appetite, lethargy, fever, maybe some vomiting. And those early symptoms, they can show up anywhere from 3 to 7 days after infection.
So it can start out looking like a pretty ordinary bug.
Yeah, exactly. And that's why it's so important to be vigilant. But then usually within a day or two of those first signs, the real trouble starts. You'll see the vomiting get worse, and then the diarrhea starts, and it's often bloody. And that's because the virus has been busy destroying the lining of the intestines.
And that damage to the intestines, that can lead to a whole cascade of other serious problems, right?
Oh, absolutely. When the intestinal lining is damaged, it can trigger this massive inflammatory response throughout the body. And in severe cases, it can even lead to septic shock, which is life-threatening.
Mhm.
And the virus, it also attacks the lymphoid tissues, which are part of the immune system, and the bone marrow, where all the blood cells are made. So you get this decrease in white blood cells, which are crucial for fighting infection. And that's called leukopenia. And that makes the dog incredibly susceptible to secondary bacterial infections. And there's also this risk of bacterial translocation, which is where bacteria from the gut leak into the bloodstream.
Wow, so it's really a multi-pronged attack on the body's defenses,
Mm.
and the blood loss from that intestinal damage must also contribute to the problem.
Yeah, definitely. Losing blood into the intestines, that can lead to anemia, which makes everything worse. And, if you were to do a necropsy on a dog that died from parvo, you'd see all this damage. The intestines would be inflamed and hemorrhaging, the lymph nodes would be swollen, and the bone marrow would be depleted. It's a really grim picture.
It sounds awful. So how do vets actually diagnose this virus? What are the tools they use?
Well, a lot of times it starts with a presumptive diagnosis. That's based on the dog's history, if it's a young, unvaccinated puppy, and the clinical signs, especially that bloody diarrhea.
Hmm.
And a blood test might show leukopenia, that low white blood cell count. But to be absolutely sure, you need to actually detect the virus itself.
And how do they do that?
Well, one of the most common methods is an ELISA test, which stands for Enzyme-Linked Immunosorbent Assay. It's a bit of a mouthful, but basically it's a test that can detect viral antigens in the feces. And it's a pretty quick and easy test to do. But there are other methods too, like hemagglutination and hemagglutination inhibition assays, serum neutralization tests, and even electron microscopy, where you can actually see the virus particles under a microscope.
I know there are those rapid tests you can do in the clinic. How reliable are those for parvo?
Yeah, those rapid tests, they're convenient, but they're not perfect. They have pretty good specificity, which means if they come back positive, it's usually accurate. But their sensitivity isn't as good, so a negative result doesn't necessarily mean the dog doesn't have parvo.
So it's like a screening test. If it's positive, you can be pretty confident, but if it's negative, you might need to do further testing.
Exactly. And in those cases, we might use something like PCR, which is polymerase chain reaction. It's a very sensitive test that can detect the virus's DNA in a sample.
So PCR is like the gold standard for detection. What about antibody tests? Would those be helpful in diagnosing parvo?
Antibody tests, they're not as useful for diagnosing an active infection. That's because it takes time for the body to produce antibodies after infection. And antibodies can stick around for a while, even after the dog is recovered. So an antibody test might just tell you that the dog has been exposed to the virus at some point, but it doesn't necessarily mean they're currently infected.
So not as helpful for acute cases. All right, so we've covered a lot of ground here. We've talked about what this virus is, how it spreads, how it affects the body, and how we diagnose it. But this virus has been around for a while now. Has it stayed the same, or has it been evolving like those articles you suggested?
Well, that's one of the really concerning things about CPV2. It hasn't just been sitting still. It's been evolving, changing over time. Back in the 1980s, we saw these new variants emerge, CPV2A and CPV2B, and they pretty much replaced the original CPV2.
So it's like a virus 2.0, basically.
Yeah, kind of. And these new variants, they had some changes in their genetic code, specifically in the VP2 protein, which is the main protein that makes up the virus's capsid. And those changes, they can affect how the virus interacts with the immune system, and they can also impact the accuracy of some diagnostic tests.
So it's like the virus is trying to outsmart us, to evade our defenses and our diagnostic tools. And that makes vaccination even more important, doesn't it?
Absolutely. Vaccination is still our best weapon against parvo, even with all these new variants, but something we have to stay on top of. We need to make sure the vaccines we're using are effective against the strains that are circulating in our area.
Makes sense. And speaking of vaccines, I know that maternal antibodies, the ones puppies get from their mothers, can sometimes interfere with vaccination. How do we deal with that?
That's a great point. Maternal antibodies, they're great for protecting puppies in the first few weeks of life, but they can also neutralize the vaccine virus before it has a chance to do its job. To get around this, we often use modified live virus vaccines, which have a higher concentration of virus particles. The idea is that some of those particles will escape the maternal antibodies and stimulate the puppy's immune system.
So it's like overwhelming the maternal antibodies with a bigger dose of vaccine virus.
Yeah, that's a good way to think about it.
Okay, and this is something I'm really curious about. Are the current vaccines effective against all these new variants, especially that CPV2C variant we talked about earlier?
Well, that's the million-dollar question, isn't it? The current vaccines, they're based on the older strains,
Yeah.
CPV2 and CPV2A, and they do provide some cross-protection against the newer variants, but it's not perfect. There have been cases where vaccinated dogs have still gotten sick, especially with CPV2C.
So it's not a foolproof guarantee.
Right. And that's why it's so important to keep an eye on the evolving situation. We might need to adjust our vaccination strategies in the future to make sure we're providing the best possible protection.
Yeah, it's like a constant arms race between us and the virus. We're always trying to stay one step ahead. So let's talk about treatment. What can we do if a dog does get parvo, despite our best efforts? Is there a cure?
Unfortunately, there's no specific antiviral drug that can kill the parvovirus. So treatment is really all about supportive care. We focus on keeping the dog hydrated, managing their symptoms, and preventing secondary infections.
So it's about giving their body the best possible chance to fight off the virus on its own.
Exactly. And that means lots of intravenous fluids to combat dehydration, antibiotics to prevent bacterial infections, antiemetics to control vomiting, and pain medication to keep them comfortable. And in severe cases, we might even need to give blood transfusions.
It sounds very intensive.
It is. But with aggressive supportive care, many dogs can pull through. And the sooner we start treatment, the better their chances.
So early intervention is key. And of course, prevention is always better than cure. We've talked about vaccination, but what else can we do to prevent parvovirus infection?
Well, hygiene, that's absolutely crucial. Because this virus is so tough, it can linger in the environment for a long time. So we need to be really diligent about cleaning and disinfecting any areas where dogs might come into contact with the virus. And bleach is your friend here. It's one of the few disinfectants that can reliably kill parvo.
So bleach it is. And I know that vaccinating pregnant mags can help protect their puppies.
Yes, definitely. When we vaccinate pregnant dogs, we're essentially boosting the level of antibodies in their colostrum, which is the first milk they produce. And those antibodies, they get passed on to the puppies, giving them some protection in those first few weeks of life.
So it's like giving them a head start on immunity. Okay, so we've covered a lot of ground in this deep dive into canine parvovirus. What are the key takeaways you want our listeners to remember?
Well, I think the biggest thing is that CPV2, it's a serious threat, and it's not going away anytime soon. And it's constantly evolving, which makes it even more challenging to control. But we do have tools to fight back. Vaccination is still our most effective weapon, but it's not a 100% guarantee. And we need to be really vigilant about hygiene, especially when we're dealing with puppies or dogs that might be immunocompromised.
And I think the other big takeaway is that early detection and intervention are crucial. If you see any signs of parvo in your dog, don't wait. Get them to the vet immediately.
Absolutely. The sooner we can start treatment, the better the outcome.
And this all really leads me to a final thought for our listeners. Considering how rapidly this virus can evolve, throwing out these new variants, how do we need to adapt our vaccination strategies to stay ahead of the game? And what role can advances in diagnostic technology play in helping us identify and respond to these emerging threats more quickly and effectively? This is clearly an ongoing challenge, and it's one that requires all of us vets, researchers, and dog owners to stay informed and work together to protect our canine companions. So, thank you for joining us on this deep dive into the world of canine parvovirus. We hope you found it informative, and we encourage you to continue learning and engaging with this important topic.
Absolutely. Thanks for having me.
Thanks for being here.